Hi, I'm Meaghan, and today I'm going to be talking about the principles of public health practice. For this multimedia project, I decided to virtually visit Headspace National Youth Mental Health Foundation, generally known as Headspace. It is a health promotion charity that supports the psychosocial health of young Australians and their families. Headspace have approximately 150 centres across Australia to support young people, most of these being in Victoria and New South Wales. For some context, there are 3 Headspace centres close to La Trobe University, and those are Greensborough, Collingwood and Glenroy. Firstly, this presentation will address the organisation in terms of objectives, target population, funding, partnerships and stakeholders, and services by Headspace, and how these elements relate to public health. Furthermore, the presentation will evaluate how principles such as equity, social justice, consumer participation and social determinants of health are incorporated into Headspace. In addition to this, how the social model of health is applied in accordance to Headspace. And finally, this presentation will display the limitations of the organisation and recommendations for the organisation in the future. To begin with, Headspace is an organisation that assists with mental health and wellbeing and social health and wellbeing. The main page of the website contains a copious amount of information on how to get support. The 3 categories describe how you can obtain information about mental health, where to physically visit a Headspace centre, as well as over the phone and online services to help with mental health. This sector is exceptionally important in these times of the coronavirus pandemic, as levels of anxiety will increase, both through direct causes including fear of contamination, stress, grief and depression triggered by exposure to the virus. Before going into details of these categories, it is important to mention the target population of Headspace. There is a clear intention of whose Headspace target in terms of their services, and that is young people of Australia as well as their families. Headspace provide a tailored and holistic mental health support to 12 to 25-year-olds with a focus on early intervention to help them get back on track and strengthen their ability to manage their mental health in the future. They also support people of all kind and embrace diversity, making it a safe place for any young Australian to seek help and improve their psychosocial health. In this segment of the presentation, there will be a focus on information and resources. This tab has more categories that are seen on this slide. The World Health Organization described the goal of public health to fulfill every society's ambition to create conditions in which all people can be healthy. The main idea of public health is to prevent injury, illness and disease, help health in communities, sustainable interventions, and to have equity in public health. In terms of public health, the informative segments under information and resources promote public health as they can prevent psychosocial illnesses, self-inflicted injuries, help young people's parents understand the seriousness and importance of mental health, as well as promoting good psychosocial health in minority groups to help them feel more included into society. Other than physically visiting a Headspace centre, there are online and phone services, which is another example of the provided services. This service is to talk to a professional about stress, depression, or really anything over the phone. This also represents public health as it does prevent the immense feeling of a mental illness like anxiety or depression and feel like someone is supporting you. These chats and phone calls can be informative to young people and help with their education on psychosocial health. The aims and objectives of a Headspace include helping young people with feeling anxious or stressed, questions about sex, bullying, anger, physical health concerns, or really just not feeling yourself. There are more on the Headspace website if you'd like to have a look. As for funding, Headspace is considered a charity, however it is funded by the Australian Department of Health. There is also a tab on their website which allows visitors to donate to their organisation, fundraise for them. It also shows the corporate partnerships involved such as Chartime, Kmart, GWS Giants and the NRL. There is little information about the contribution of these partnerships towards Headspace, but it is assumed they receive a lot of income from both partnerships and the government to fund services. There is also a form to fill out presented to the public which can make any person a stakeholder or become a partner of Headspace. Chang 2002 describes various definitions of equity in health, but from the article it can be gathered that equity in health is to ensure that everyone has a fair and equal opportunity to obtain optimal health and well-being. Headspace is a prime example of equity in health. It ensures that everyone feels welcome to attend one of their centres or use one of the online services. There is an acknowledgement to the traditional owners of the land and claim that there are appropriate and safe spaces for Aboriginal and Torres Strait Islanders to use Headspace as a mental health service. Headspace also claims to be committed to embrace diversity and welcomes people from the LGBTQI+ community to access their services also. Headspace is considered primary care as it is a healthcare centre, but it has frameworks to help with the affordability, accessibility and availability of mental health awareness and support. Headspace has tailored programs to help people who come from different cultures, lifestyles, faith, locations, sexual orientation and gender identity, making it an accessible service. Headspace is also free or little cost, therefore it is easily affordable for every young person to participate. The programs do seem readily available to young people. The online calls are also open 9 a.m. to 1 a.m. Melbourne time, 7 days a week for a one-on-one chat, which not only is incredible for young people suffering during the times of the pandemic, but it also promotes availability in terms of public health. Ongoing from the acceptance of all people of any background, Headspace displays social justice. This can be seen as they censor a structural disadvantage and discourses of disadvantage within groups of people and provide information and resources to help empower these people to obtain good psychosocial health. Headspace also helps these people's families with helping their loved ones and helping them with their needs. This protects and promotes basic human rights and therefore social justice. As for consumer participation to further develop Headspace, there are tabs such as the feedback tab, as well as family and friend participation. It is said that young people are involved in the decisions about their care at all points in their care pathway, including a collaborative treatment plan. The social determinants of health are conditions in which people are born, grow, live, work and age. These circumstances are shaped by the distribution of money, power and resources at a global, national and local level. Headspace help close the gap of health inequalities as they provide a free or little to no cost social service to help with social exclusion and mental health. Headspace can also help with work and study, which can improve the unemployment rate and educational level among young people in Australia. Headspace is considered to be applying the social model of health approach to their organisation. This is due to the elements in Headspace that promote equity, sustainability and the domains of public health practice. As mentioned earlier, Headspace is for all people regardless of background, so I won't be going into too much detail about this as I would be repeating myself and that would be very boring. Secondly, Headspace is considered to be sustainable. To compare, the biomedical model of health assumes that patients are passive followers of their doctor's order, further to diagnose and prescribe therapy, which can be unsustainable because it does not take into considerations people's lifestyle, cultural factors, social support and all that sort of stuff, whereas the social model of health does. Therefore, Headspace does use the social model of health approach as it ensures every type of person from any kind of background can access information and services and have tailored services depending on their social situation. Lastly, the domains of public health practice are to be considered as a part of the social model of health approach. For example, there is prevention in Headspace because they identify psychosis in young people and further know how to prevent early onset. If there is identification in early stages of psychosis, then health professionals can prevent this from happening in other people. They can also prevent other self-inflicted injuries from mental health illnesses. There is promotion as programs can help reduce developing psychosis, and they can also promote education of various mental illnesses among family and friends. There is protection as there is treatment of psychosis or of other mental illnesses through medications or organic remedies such as fish oil. There is monitoring as mental well-being through the physical services are being monitored, and therefore there's surveillance as there is examining through these services. Finally, there are some limitations with Headspace. These include rarely any medical definitions. This includes statements like chemical imbalance or reference to different parts of the brain to show why people have a mental illness. This can make individuals feel like there is no logic behind what they are feeling. And in order to fix this, the website should implement another page or tab with more biological or medical definitions, which can help people understand and recognize that their feelings do have a logical understanding behind them. Secondly, relies on individuals to make a good choice. So if a young person has problems and seeks help, they can gather all the information in the world and all the help in the world, but it is ultimately up to them to fix their health, which can cause problems such as being unmotivated to help. Lastly, there is website complications. In this time of the coronavirus pandemic, visiting mental health websites and seeking professional help is a really good thing. However, on headspace.org, it can be very confusing to find exactly what you're looking for. There are often tabs after tabs after tabs, which can really decrease motivation when trying to find help and trying to find something specific. So in order to fix this, I recommend that there should be a direct and easy way to find specific information or to seek serious help, instead of going through 5 or 6 tabs to find the lifeline number. To conclude, Headspace National Youth Mental Health Foundation is an appropriate healthcare centre looking after young people's psychosocial health and well-being. It shows measures in place that relate to public health practice and promotes, prevents and protects mental health and social health. There are principles Headspace uses that include everyone to be supported by these services. All in all, Headspace is a very appropriate and very good centre to be supported by. I hope you enjoyed my presentation.